Hello, my name is Jones Muna. Today we look at discharge plan. Introduction. Discharge is something that is expected immediately after the patient is admitted. It is very important because the well-being of a patient depends on the care after discharge, especially on chronic condition. Therefore, successful discharge planning depends on the exchange of information among the client, the caregivers, and those responsible for care of clients both in the hospital and at home. Planning the discharge begins on admission, when information about the client is collected and documented. This document discusses the discharge plan, assessment, diagnosis, teaching plan, implementation, and evaluation, and also defines the term discharge plan. Objectives. General objectives. At the end of the lesson, students should be able to acquire knowledge on discharge planning. Specific objectives. At the end of the lesson, students should be able to 1. Define discharge planning. 2. Outline discharge planning needs assessment. 3. Outline the information, education, and communication. Definition of terms. Discharge. Defined as allowing a person to go or send them away, Longman, 1991. 1. Discharge plan. It is a process that incorporates the assessment of the patient's needs with inputs from patients, significant others, and the healthcare team, which results in a plan to coordinate available resources to meet patients' needs, Luckman, 1997. 2. Discharge planning. It is the systematic process of preparing the client to leave the healthcare facility and for maintaining continuity of care, Taylor, et al., 1997. Needs assessment. Assessment involves collection and organizing data about a client. When assessing the client for discharge, the family is included as a unit of care. If the transition from the hospital to home is to be successful, the client and the family must be actively involved in the discharge process. The assessment process therefore includes health data, personal data, caregiver, environment, financial and support services. Health data. This refers to medical records and doctor's orders, which must be consulted for exact medication and treatment before a discharge plan can be developed. In case of any invasive procedure, they should be carried out before the patient is released from the hospital. And any equipment for use at home must be ordered before discharge, e.g. catheterization, colostomy, and any subsequent changing of these devices. Equipment and supplies. Assess for adequacy of storage facilities like refrigeration for storage of insulin in case of insulin-dependent client. The storage space for dry stocks like bandages, swabs, and gauze in case of wound care is also assessed. Personal data. Physical condition. In this data, the doctor or nurse tries to find out how the client is feeling about the whole discharge process, e.g. is the client happy or sad. Caregiver. The nurse should establish who the caregiver is before the patient is released, i.e. sex, age, and the relationship to the client. This is important because it helps in establishing whether the caregiver is able to give quality health care, knowledge about the disease, and the age is crucial as very young age cannot offer quality health care to the client. Establishment of the relationship between the client and the caregiver is equally critical because if the two are staying together in the same house, it also means that continuity of care is easy, unlike if they are not staying together. Home environment. Living arrangement. Long-term caregiving may require structural remodeling of the home and may result in the social isolation of the caregivers. The living arrangement may change in the sense that the caregivers may not have the time for social activities because most of their time will be spent at home taking care of the patient. On the other hand, there will be need to change or exchange bedrooms in cases where the house is an upstairs home, e.g., where an amputated patient's bedroom is upstairs while other bedrooms are downstairs. The house where the patient lives is assessed for ventilation, size, number of people living in that house, possible accidents, hazards, and also water and sanitation, as this may help in identifying potential problems. Support system. Assess the client's and family's resources and support systems, including the immediate and extended family, and find out if these people are willing to support this patient. Determine together with the family and client the adequate coping mechanisms to manage the illness and the common stressors of home care. Find out if the client and family have the knowledge of the external supports available and if they are willing to use these external supports. Learning needs. Assess the knowledge base of the client and family concerning the client's condition because families can become overwhelmed with the burden of caregiving. To manage home care, family members must acquire new knowledge and skills, be motivated to help the client, and adapt to the changes according to expectations of family members. The client and family members should be empowered to participate wholly in the decision-making and the care needed. Emotional responses. Assess the client's attitude towards discharge. Find out about client's feelings about the diagnosis, discharge and home care and expectations. Assess for potential role conflicts and strain on caregivers. Financial assessment. Financial assessment must be undertaken before discharge because home care can be a significant financial burden for families. Home health care can be expensive and is usually not completely reimbursable. Cost analysis indicates that home care expenses vary in relation to the type, intensity, and length of services needed. Find out about the client family's financial status and also if the client has a life insurance scheme and the insurance coverage. Find out also if the client family will be able to meet the supplemental care expenses for the client, for example, if the client will need to be going for physiotherapy after discharge and also food supplements. All these need financial support. A social worker can be involved depending on the financial status of the client family. Diagnosis. The nursing diagnosis for a discharge plan healthcare is based on the medical diagnosis and the findings in a patient's assessment such as an effective individual coping up with related current lifestyles following an amputation, e.g. a limb, which results in ability to bath, dress oneself and how to use crutches. This requires follow-ups by the nurse to see how the patient is coping up with the situation. Knowledge deficit related to medication, e.g. the age and the educational level of the caregiver, which can affect caregiver if he or she is too young or knowledgeable enough in the treatment schedule given by the health facility. Teaching plan. This refers to the elements that should be taught to the client and the family, such as medication, what each medication is for, and how to take it. Side effects the client should report about. The expected outcomes of each medication. Drug compliance. Diet, the type of diet. Food restriction. Expected fluid intake or restrictions. Need for protein, iron and/or added potassium. Pain control. The client should be taught how to treat pain. Alternative method of reducing pain. What to do if pain is not relieved, worsens. Activity. Desired positioning of the client just to relieve pain. How to perform a range of motions or other specific exercises and frequency and distance for ambulation. Importance of review dates. Clients and relatives should be well informed about the review dates so that the patient cannot forget the dates and where to go for reviews. Implementation. This implies the actual carrying out of the teaching plan. All teaching should be documented in the nurse's notes and the discharge summary. Written instructions are given to the client and return demonstrations must be given to the client relatives, e.g. colostomy changing. Evaluation. This is very crucial as it is an ongoing process. This is crucial in making the discharge planning work. Planning must be scrutinized to ensure quality and appropriateness of services. Conclusion. The nurse is a primary person for ensuring the responsibility continuity of care as clients move from one type of healthcare setting to another. Discharge plan is an essential component of health nursing in meeting the client health needs in the hospital and community. It is an important channel in meeting clients' and relatives' psychological and physiological needs and their aspirations in the community. However, follow-ups to see how the discharged clients are coping up with life in the community are difficult to be exploited to the fullest due to inadequate staffing levels in the health institutions. Therefore, the country needs more health workers in the system, especially in rural areas, if the battle is to be won so as to meet the Ministry of Health vision of taking health service as close as to the family as possible. Thanks for listening and keep studying.